Thank you on behalf of the International Society for Quality of Life Studies for joining our webinar today. This is called Conceptualizations of Wellbeing and Quality of Life, Global Trends and Future Directions, featuring our ISQOLS Post-Doc Fellows, Dr. Kate Sollis and Dr. Hossein Mousazadeh. The discussant for this webinar is Dr. Arthur Grimes. He's one of our ISQOLS board members. He's a senior fellow at Motu Research and professor of wellbeing and public policy at Victoria University of Wellington. He'll be facilitating the Q&A and serving as the discussant for our session today. Now to our presenters. Our first one, our postdoctoral research fellow, Dr. Kate Sollis, is a research fellow at the University of Tasmania and president of the Bega Valley Data Collective. Her work focuses on engaging communities in developing wellbeing policy frameworks and measurement tools, emphasizing participatory approaches that make wellbeing measures more relevant and impactful, especially for non-WEIRD, W-E-I-R-D contexts. She holds a PhD in social research and has over 10 years of experience in wellbeing research. Our second presenter, our other postdoctoral research fellow, Dr. Hossein Mousazadeh, is a postdoctoral researcher assistant at Purdue University John Martinson's Honors College, although his position has changed. His research promotes health equity and community well-being through sustainable development, community empowerment, and experiential learning. He's an active member of ISQOLS since 2019, also serves as a journal editor, and is affiliated with several research institutes and professional organizations. With that introduction, I will turn it over to our presenters. Dr. Kate Sollis will take it away. Thank you.
Well, thank you so much, Jill, and it's really lovely to be presenting to you all today. As Jill mentioned, I'm a research fellow at the University of Tasmania down in Australia. And I also feel really privileged to be one of the research fellows, postdoctoral research fellows for the International Society for Quality of Life Studies. I'd also like to note that, as I mentioned, I'm presenting today from Australia, so from the lands of the Yuin people in the far south east corner of Australia. I'd just like to pay respects to elders past and present. So today in this discussion on global trends and future directions in wellbeing and quality of life, I'm going to be focusing specifically on the value of community engagement. So in terms of what I'll be stepping through today over the next 20 minutes or so, I'll firstly talk a little bit about what the value is of engaging with communities when measuring wellbeing, and then bringing you to the Australian context and talking about some of the wellbeing initiatives that exist in Australia and the extent to which they have engaged with community when developing wellbeing frameworks. I'll then conclude with some key takeaways and really talking about what the global trends have been in this space and what I think the future directions are. So firstly, part one, so the value of engaging with communities when measuring wellbeing. So I've mentioned the term wellbeing frameworks a few times, which really they predated the Beyond GDP movement, but definitely spurred on by that movement and that notion that what we measure affects what we do. And here are some examples of some wellbeing frameworks that exist around the world, with a wellbeing framework broadly defined as a set of dimensions or themes or domains that seek to reflect what wellbeing means to a community. And really from a holistic standpoint, so thinking about the various elements of life that contribute to our wellbeing. So where does community engagement play a part, and what is the benefit and value of community engagement for developing wellbeing frameworks? So firstly, when we engage with community, when we incorporate participatory approaches into the development of our measurement tools or wellbeing frameworks, it helps ensure that the dimensions and indicators that we come up with actually reflect understandings of wellbeing for the community, or actually measuring what truly matters. This kind of engagement can also empower individuals and communities. So being asked the question, what does wellbeing mean to you? And having those sentiments incorporated into research and policy can have a lot of wellbeing benefits for individuals and communities themselves. So the actual process matters as well as the outputs. Engaging with communities can help ensure community buy-in. So this is probably more from a policy perspective, but also from a research perspective. that when communities are engaged in the development of these kind of frameworks and tools, it creates more buy-in. And so that can enable, wellbeing policy frameworks to be more impactful and more likely to be implemented in policy if the community is behind it and says, hey, we developed this thing, you should incorporate into policy, it should affect decision making. Again, probably more from a wellbeing policy perspective, incorporating community engagement in the development of wellbeing frameworks can help depoliticize initiatives. So rather be a wellbeing framework being seen as the product of politicians, it's actually seen as a product of the people. And that kind of grassroots support can help depoliticize it and help ensure its longevity. And finally, the process of community engagement in developing wellbeing frameworks can help strengthen democracy. So deliberation processes where people are in a group and they hear diverse views and perspectives, and they debate, what wellbeing means and how wellbeing should be influencing policy. Just that kind of deliberation process and hearing other viewpoints helps strengthen democracy by understanding that the policy process is very complex and can help enhance social cohesion. So my plan today, or my aim, was to discuss all of these things, and I quickly realized that wasn't going to be possible in 20 minutes. So I'm just going to focus on this first kind of benefit of ensuring dimensions and indicators reflect understandings of wellbeing for the community. But I'm very happy to answer questions about the others in Q&A. I could probably talk about this topic for hours. So in terms of kind of research that I've been doing in this space with a number of colleagues, in terms of better understanding how understandings of wellbeing differ by communities. So I want to bring your attention to a systematic review I undertook with my colleagues Mandy Yap, Paul Campbell, and Nicholas Biddle a few years ago. And so this work is published in World Development if you want to check it out. And so we did a systematic review of essentially studies around the world, studies as well as kind of more practitioner examples, as well as policy examples that went out and asked communities, what does well-being mean to you? And so through that process, we identified a total of 133 frameworks that express understandings of well-being for different communities around the world. And so we looked at a number of components of these studies and processes, like the methods used and so forth. But today I'll just talk about the understandings of well-being that were raised in these studies. So we did a thematic analysis of the different areas of well-being that were brought up. And these were grouped into a number of different areas. So overall, we had 30 well-being areas that we identified. And so these are these smaller areas in smaller text. And they were then grouped into kind of broader categories that we call well-being clusters. So these well-being clusters comprised economic security, spirituality, psychological health, relationships, education, physical health, social participation, and activities in daily living, which comprise things like recreation and leisure, independence and autonomy, sense of purpose and meaning. So when we look at how often these different wellbeing areas are raised in different frameworks, we can see, so this is the graph here. So this shows the percentage of frameworks for which each wellbeing area is raised. So for example, other relationships, which was relationships with friends or neighbors, was raised in 90% of frameworks we examined. And so we can see that the wellbeing areas that are commonly utilized in wellbeing measurement tools and wellbeing frameworks are the ones that we also see appearing most commonly in these studies that actually go and ask people what wellbeing means to them. So things like other relationships, family relationships, emotional wellbeing, physical health, financial security, recreation and leisure, community and belongingness. I'm sure these terms are new to no one here. They're very commonly used measures and dimensions in wellbeing frameworks. So one could look at this graph and say, okay, well, actually, maybe we already know what to measure. Maybe we don't actually need to go out and do this exercise of asking people what wellbeing means to them. But to that, I would also point out these least commonly raised areas. So things like connection to culture, mobility, aspirations for future civic engagement. If we group these less commonly raised areas together, we actually find that 2/3 of frameworks raise at least one of these areas, which just highlights the vast majority of frameworks. While they probably all have many of the very commonly raised areas, they also contain kind of more novel or unique areas that are quite specific to that community. Furthermore, if we look beneath these wellbeing areas that we've thematically come to, there's also huge divergence in how each of these wellbeing areas is conceptualized and expressed by different communities. So that's also really important to note. We also did some additional analysis from that and so did some more statistical analysis assessing whether communities from different cultural groups are more or less likely to raise different wellbeing clusters. And this is also published in Social Indicators Research if you want to go and have a look at the paper. I won't go through kind of all the tables now, and I just wanted to kind of express it as easily as possible. So what we found is that there are kind of these wellbeing clusters that you could broadly define as universal. They were equally likely to be identified by different cultural groups. So for example, psychological health, relationships, physical health, spirituality, and education. However, there were 3 wellbeing clusters that were more likely to be raised by certain groups. So for example, activities and daily living were significantly more likely to be identified by communities in Anglo-Saxon countries. Economic security was more likely to be raised in communities in Southeast Asian countries and African and Middle Eastern countries. And finally, social participation was more likely to be raised in Indigenous communities throughout the world and also in African and Middle Eastern communities. So this begs the question, does this present problems for wellbeing measurement? And my scientific assessment is probably. So some of you might be familiar with Joseph Henrich's work, The Weirdest People in the World, highlighting that the Western context is particularly unique, and that fact might present problems for the research that we're doing. And so this has been examined from psychology research more broadly. So a review of research samples from studies in the top 6 psychology journals found that 68% of those research samples were from the US, 14% were from other English-speaking countries, 11% were from Europe, 1% were from Asia, and 1% were from Israel. So we can see a huge bias in terms of psychology studies basing their samples in Western context. This is all also been assessed by Motu and Josh and Lou in terms of the influence of this on wellbeing science and the fact that it's been dominated by Western philosophies of wellbeing, with other philosophies such as Islamic or Eastern philosophies of wellbeing gaining little attention. So watch this space. So I'm currently working on a paper with a number of colleagues, including some ISQOLS members, which is great, on kind of digging into very commonly used global wellbeing measurement tools and assessing the Western bias in them. So yeah, watch this space, and I hope to share that research in the next year or so. So finally, just to talk briefly about some community engagement initiatives in Australia and the extent to which they've, or wellbeing initiatives that have incorporated community engagement. So firstly, I want to talk about Australia's Measuring What Matters framework, which was released in 2023, so it's still quite new. And it seeks to measure wellbeing across 5 themes: being healthy, secure, sustainable, cohesive, and prosperous. Just to give a bit of outline of the development process for the framework and the extent to which it incorporated community engagement. So in October 2022, the government announced that in their budget that it will develop a wellbeing framework entitled Measuring What Matters. Between October 22 and January 2023, the first consultation phase was conducted, and that was really trying to engage with what I call technical experts, so largely economists and statisticians. And they were asked to provide feedback on the proposal that the government put forward. And while the government didn't state it explicitly, there were broad indications that the OECD framework, wellbeing framework, would be used. So funnily enough, during that consultation with technical experts, many of those technical experts said, you shouldn't just be engaging with us, you should be engaging with the general public. And I was one of those technical experts that provided that feedback as well. So to the government's credit, they adjusted their plans and they said, okay, let's do a community engagement phase. Before they did that, they identified 5 preliminary themes that they said they identified based on this first phase of consultations and also a review of international approaches. But I have a few question marks there because it's not clear how they incorporated this consultation phase into that process, because asking the question kind of what does well-being mean for people in Australia was not a question that was asked in that process. So I suspect those themes came more from the review of international approaches. The second consultation phase then engaged with community groups, MPs, and organisations, and they were encouraged to hold feedback sessions to provide feedback on those preliminary themes that were identified. So that was just a 6-week process between April and May 23. And then a couple of months later, the framework was released. So how well did it do to engage the community? And again, my scientific opinion is okay at best. And so a paper I published with Paul Campbell and Nicholas Drake just a couple of months ago assessed this engagement process based on 4 criteria. So whether it was comprehensive, whether it was wide-reaching, whether it was transparent, and whether it was genuine. In terms of comprehensiveness, in terms of how deeply it engaged with the community, we kind of gave it a not great score. So the consultation period was very short. It was only 6 weeks. And it only used a single mode of engagement, like sending out a feedback form, and there was no communication strategy to engage the wider community. It was also not wide-reaching. This consultation process was done through a policy submission process, which most people don't know about. So that really engages only those who are already engaged in policy processes. The consultation was not transparent, so there was no publicly available consultation report following that process. And in terms of being genuine, so, did the government listen to what people had to say and adjust the framework? There were indications that they did. So they certainly read the feedback forms that were sent through. They certainly incorporated some feedback into the framework, but largely related to the data side of things, and largely kind of things that were easy to implement. So some really kind of the bigger points of feedback and the more comprehensive things were not really addressed. So wider consultation was also mentioned in that public consultation phase. You need to be doing this better and to more people. So that wasn't addressed, as well as the really important point about you need to embed this in policy so it's actually impactful, which has unfortunately not really been the case. So yeah, my colleagues and I addressed, kind of followed on from this study in a conversation article about whatever happened to the Albanese government's wellbeing agenda, where we discuss how the fact that how this wellbeing initiative, which has unfortunately very much dropped off the agenda, it's not talked about by government, it's not talked about by community, and we argue that the lack of consultation in the process is one factor that influenced it being dropped off. And so finally, I just want to talk about a second initiative that's very close to my heart, the Living Well in the Bega Valley, which is an initiative of the Bega Valley Data Collective. And so that's where I live, so just in the southeast corner of Australia. It's an incredibly beautiful area of the world. We have stunning untouched beaches, a lot of national parks and nature. It's quite far from both Sydney and Melbourne, the 2 closest big cities. So tourists have to travel quite far to get here. And it's also a very big dairy farming region as well. So Bega cheese is very well-known cheese in the country. And so our mission is to develop a wellbeing framework based on collaboration, data, and action. So we really want to try and get this process right from the very beginning to the very end by engaging widely in the community, by doing that community consultation, by understanding what wellbeing means and by bringing the community along with us, by identifying data to align with those sentiments, and really importantly, by turning those insights into action. So co-designing solutions with the community and advocating for improvements that will enhance the wellbeing of the Bega Valley. And I think on that action point, we hear a lot of sentiments like what gets measured gets treasured. And I think there is huge value in putting data out and making it more accessible. But I think we actually need to do things with that data to actually have impact as well. So that's why we see that action point as really important. So I think I'll just finish off quickly with some global trends and future directions. And so this is really just wrapping up. So there's huge value in engaging with communities when measuring well-being. We all need to be doing more of this in our work. I know it's time consuming, I know it's costly, but I think we should be considering how to incorporate that into, for example, funding applications when we're doing work on well-being. And for too long, we have relied on Western-derived measurement tools. So we need to include more diverse voices in the development of how we measure well-being of tools and frameworks. And so watch this space for more research coming out in the next year or so. And governments and communities should engage closely with the general public when developing well-being frameworks. I'm probably maybe a bit harsh and critical of especially the Australian government for not doing enough. But on the flip side, I think governments are starting to recognise the importance of this community engagement. They're doing a little bit more, and I think we're all kind of on a learning journey to do more of this work. And so I think we can kind of keep pushing for better engagement, for wider engagement, so we can make sure these wellbeing frameworks will actually reflect what wellbeing means to the community, but are also more impactful as well. So thank you so much for listening. I'll hand over to Hossein now, and I really look forward to Q&A at the end.
Thank you so much, Kadir. I appreciate it. Thank you for your talk. I'm going to share my screen and start my presentation. Oh, there you go. I think now it's good, right?
Yeah, that looks good to me, Hossein.
Thank you. So, once again, thank you so much for everyone who's joining us today for the webinar hosted by ISQOL from around the world, Australia, Europe, Africa, and maybe Europe. But I'm going to talk about well-being and quality of life and as a global trend and the future direction, which I'm talking about today is our recent research project in Purdue University Purdue Center for Rural and Migrant Health about the community-based intervention for improving the quality of life by focusing on the globally, but focusing in detail in North America. It's included Canada, United States, and Mexico. And my name is Hossein Mousazadeh. I'm a research scholar at Purdue University. I'm also as a research fellow, as a postdoctoral researcher at International Society for Quality of Life. So, just an introduction. I just want to get more familiar about the nature of community-based intervention, which I will call in this presentation as a CBI. CBI are locally driving program that actively involve the communities in addressing their own need. So what does it mean is a part of CBPR, community-based participative research, where the community they can find their own need and their challenge, and they can participate from beginning of the project to the publication, even for the follow-up the project, which includes their collect the data, interviews, meeting, and then analyze the data. And the core feature of the CBI is participation and empowerment, context-specific approach, collaboration, and sustainability, which there is a three main core or direction for the CBI, which is called participation, empowerment, the communities, and sustainability, which is called like follow up the project. Why the CBI is a matter and why is important? The communities are not just benefit from their development; they are also architect of their own well-being. What does it mean? Like it means as the communities, the leaders, stakeholders, even the local communities, local people in communities should involve in the project, and they should find their challenge they need and how they can improve their own quality of life and well-being. That's why there is a four main core for the CBI, which is showing importance of the CBI in the improving the quality of life. The first is improve the physical, mental, and social well-being. The second is enhancing the access to resources, strengthening the social capital and resilience. And the fourth is address health disparities and the inequities. Here, since the quality of life is connected to the health-related quality of life, there's another initiative. It's called Community-Based Health Intervention, CBHI, which focus more on health. There is a sixth principle of the CBHI, with one of them is for quality of life, which is also include many of the indicators, which is enjoyment, being happy, facilitate, feeling good, feeling well balanced, and feeling the safe living condition, and having the enough money, which is focused on the economic part of the well-being, which was called economic well-being. The other principle of the CBHI is different from what we are going to focus today about the quality of life and well-being. As a CBI, as a global scale trend, I just find the four different communities around the world: the Africa, Asia, Europe, and North America, where the CBI, they are focusing more on the research. Which part of the CBI they focus more? In Africa, the community CBI is the community health workers, which focus on improving the maternal child health, reducing the preventable disease. In Asia, the community-based intervention is focused on community-led disaster recovery, which focus more on restoring the housing, safety, and the psychological well-being. In Europe, the CBI focus more on mental health and social inclusion program, which tackling loneliness, improving the community's cohesion, which is recently we work on the community quality of life, which is a program we submit for NIH, National Institute for Aging, is a part of that. I really surprised when I see this. Most of the CBI in Europe is focusing on the loneliness, but our project focus more on the aging, how the community quality of life can improve the quality of life and well-being of the aging in rural of Indiana, where Purdue University is located in Midwest of United States. In North America, the CBI focus more on community resilience and well-being initiative, which is enhancing the life satisfaction, reducing the health disparities. These four different parts of the around the world to see how CBI community-based interventions from different place are focusing on which type of the CBI in their research. Here I'm going to just show we just focus on 2000 to 2024. As you can see, every year the research in CBI and quality of for improving the quality of life is increased. Just in 2019, because of the COVID-19, there's a decrease of the research. But again, after the COVID-19 finished into 2022, in 2024, there is a most recognized year for the publishing the research in CBIS around the world. As you can see in the right picture, which I'm using the VOS viewer to see and find the most recognized journals, the published CBPI and the Quality of Life and Wellbeing Initiative. You can see the BMC, Public Health, and the Plus One, and also the Lancet. They are the 1 to 3, number 1, 2, and 3 journals that publish CBI and quality of life research more than the other journals. The key model and the approach for the CBI and quality of life is focused more around the world on community-based participatory research, which called CBPI, CBPR, and then health promotion and education models, which I'm going to talk about the models in the North America and especially in United States, and then resilience and empowerment. How the CBI can to increase the resilience and empowerment for the youth, children, women, and the different communities around the world, and especially for North America. Top keywords in the CBI research and quality of life. I just find and use the VS viewer to see the keyword and frequency of the keyword from 2000 to 2024 for 24 years. The human is focused more than the others. The female and then male they are the keywords based on the research published before in the journals, in research journals. And then I'm going to discuss about the keyword and show the cluster, which is the trained subject in the CBI and the quality of life and well-being in next slide. So CBI and the quality of life, it's a sample for rural setting in North America. In rural area of the North America, the community-based intervention as the CBI are vital for improving the quality of life, addressing the localized challenges and needs of the communities, such as healthcare, access, economic opportunity, and social inclusion, and also the well-being. That shows that according to the overall half of the total number of publication, the United States played a significant role in this area. That means more than the half of the number of publications published by the United States researchers in institutes and research centers in North America. Here I'm showing again with viewer as a co-current to show the keywords, most important keywords, and the cluster is showing in 4 different clusters, which I'm going to talk about in next slide. We have the 4 clusters, the red, blue, green, and yellow, and I will talk about which each cluster means, which is a team, what is a sub-team for each cluster based on the viewer. Indicating this keyword as a human, female, health and promotion, male and rural population. It indicates research in this field focus on individual level health outcome. It means the human centers, which is a new initiative in Purdue University, which called One Health. I believe maybe in the different universities around the world, they have an initiative, it's called One Health. The health for environment, animal, and human. That's why the human focus in CBI, community-based intervention, are most important for human subjects. How we can make sure the CBI can affect to improve the quality of life for the communities. The CBI work because the CBI is work in the different communities and is based on the research done before and published in many of the journals. CBI works because they address the root of the challenges and also the as a new initiative for the different communities around the world. CBI are not just kind of focusing on the communities, also is focused on the social determinant of the health because they are locally focused and can tackle issues like the economy, neighborhood, and built environment, and also social community context, which is focused on the community building and also community empowerment from different type of the group. It's included women, youth, children, and also just an example in United States as an African American communities. Which I mentioned before, we find 4 different clusters, which is red, green, blue, and yellow. We call as a trained subject in quality of life, CBI and quality of life. And this project especially focused on the north part in North America, which includes again United States, Canada, and Mexico. The red cluster as a team is core mission and the holistic impact. This cluster focus on the central and the overreaching goal of improving quality of life in rural North America through the community-based intervention. The key takeaways from this red cluster as the first cluster and most important cluster is this cluster represents the core mission of the entire field, focusing on the comprehensive practical strategies to holistic community development. The second trend or second cluster, which is green and is focused on demographic, focused and tailored intervention. The focus in the green cluster is understanding the specific demographic group, which is again including the different communities and group, which is most focused on rural setting, about the children, women health, and the different specific different group like African American in the United States. The key takeaway from the green cluster is research in this cluster emphasize the need of the consider unique population to tailor intervention that are culturally and demographically approached. Because in CBI, we believe that there is a different, we should take care of the community and their culture. As I mentioned, each of area, especially around the world and United States, they have their own culture. We should design the intervention based on their culture. The third trend in our study was blue, which is a team focused on the scientific rigor and the child health. The focus is using the rigorous evidence-based research methods like the clinical trials to address the health challenges in children. The key takeaway in this cluster focus on the evaluating highly effective evaluated intervention for children health. The last cluster, which we call as a trend in the CBI and improving quality of life and well-being, is yellow, and the team focus is foundational research and need assessment. The focus on this cluster is employing descriptive and the epidemiological studies to understanding health status and the need in rural youth, which I mentioned before. The different group located in the North America, children, youth, women, and here in the yellow is focused more on the rural youth, as in empowering the youth by the CBI, I mean community-based intervention. The key takeaways from this cluster as a yellow is foundational research that provides Baselian data, inform the need assessment, and the guide the development of target CBI for the rural youth group. Here on this slide, I want to talk about the pathway to improve the quality of life, how the CBI can affect and improve the quality of life. There is a 4 different focus area how the CBI improves the quality of life. The first is health outcome, which is CBI reduce the disease burden, better access to the care. The second is psychological well-being, which is empowerment, sense of belonging, reduce stress. Because the empowerment is the most important in CBI, I mean this community-based intervention, and how they can increase the sense of the belonging, how they can stay in their communities and are not going to move from rural to urban areas. And third one is social cohesion, is stronger communities ties, reduce the isolation, which I mentioned before. In Europe, most of the CBI focus on isolation, and our research application for NIA, I mean National Institute for Aging, focus on isolation and aging in rural of Indiana. Economic, environmental, and benefit. This is a focus on local resilience and sustainability and ongoing project and follow up the project, which called sustainability in CBI. Here, I'm going to talk about the CBI and quality of life as a North America as a sample. There is a different models in the North America, especially in the United States. They are using to improve the different model of the CBI. They are using to improve the quality of life and well-being of the communities. The first model and the initiative is Community Health Worker Program, which focus on the training local residents, how they can access to health, education, and connect people with the resources of their communities. It included workshop, access for the local resources, and how they can learn more about their communities. The impact of this initiative and program is improved health outcome for the condition like diabetes in underserved communities, especially in rural areas. The second model initiative program is Healthy Food and Active Living Initiative. This model and initiative and program focus on the creating community gardens, promoting farmers markets, and building safe public space. The effect of this program is increase the access to nutrition, food, and opportunities for physical activity, particularly in urban and rural food desert. The last program and the third program, which is important for the mental health and as a first aid training, again, is focused on the public education training, how the people can educate the local communities. The impact of this program is increased mental health literacy and the social support within the communities. As a takeaway from this presentation, which is I mentioned is a part of our last research project in Purdue University, Purdue Center for Rural and Migrant Health, which I worked with my last PI, my last supervisor, Dr. Huba, who is the head of the Department of Public Health at Purdue. Here is kind of takeaway from this presentation. The first is community lead and holistic. The CBI empowers the communities to lead their own changes, to find their challenges, their need, and work with their stakeholders, communities, and academia to create broader improvement in health and well-being, their own well-being. The second takeaway is CBI improve quality of life holistically. What does it mean? It means the intervention go beyond addressing a single issue. It's focused on empowering the youth, empowering the women, empowering a specific group like children or African American. The third takeaway from this presentation for the researchers can be collaboration is the key. What does it mean? Again, CBI cannot build one way. In CBI, we should just focus one way as like each of the community and the leaders and stakeholders and academia. They have their own way. We should move from my way and own way to highway. What does it mean? Like altogether, we should move from one way to highway as a collaboration, which is the key important subject of the CBI as a takeaway from this presentation. The last takeaway is adopt, innovate, and scale. Will challenges exist by CBI? Future of the CBI is bright. The future direction for the CBI to improving the community improving the quality of life are the first interaction with digital technologies, which I believe there is a new intervention in the Cornell University in New York. They are doing some digital technologies to create the new intervention. Just an example, they're using the AI to create the new application as an intervention to use for the aging, because more than 50% of the aging in New York are immigrant. That's why they are going to use the AI as a digital technologies for improving their quality of life and create a new application for their immigrant. The second direction is more cross-sector partnership. Should work from different research centers around the world, which I believe the ISQOL, International Society for Quality of Life, can play a key role to connect the researcher and the community around the world. The third is emphasize on the equity and the inclusiveness, which is called about the emphasizing in equity and how the communities from different perspectives they can work together. The fourth is scaling successful local intervention globally. Again, like a global research, the researcher should work together to create a new initiative, create a new CBI in different communities, even in urban or rural areas, to improve quality of life by CBI. The last future direction is emphasized on translating research into the practice and fostering collaboration. We should just move from just research to actionable plan, which is mean like when we create the new CBI for the different communities and different type of the group as a new intervention, we should just move and work on the real world challenges, and it should be actionable plan. As I mentioned before, this is a kind of program and the research we work on the Purdue University, and we are going to develop this research in the Ag department, which is just moved from public health to the Ag department, agriculture department, Purdue, to empowering the women and improving the quality of life by new intervention, which is Department of Food Science. We have a kind of new initiative which called healthy food and the food as a medicine. This intervention, we are going to develop our research and research more about the intervention, how the intervention can improve the quality of life in Indiana, where Purdue University is located. Thank you so much.
Thank you
Well,
so
thank
much.
you.
I'll turn it over to you, Arthur. Sorry, go ahead.
Thank you very much, Jill. Hi to everyone. Hi, and thank you very much, Kate and Hossein, for those very interesting presentations. I'm going to start off with just a couple of comments and questions, and then I see we're starting to get some questions through the chat as well, which I'll mediate. Kate, thanks for your fascinating presentation coming from a neighbouring country. Of course, our wellbeing framework has also disappeared in its almost in its entirety, pretty much like the Australian one from New Zealand. And so, and I think that does illustrate, as you're talking about, the problem of essentially top-down driven approaches, which really are not sustainable. They don't. I recommend to everyone, by the way, an article by Amendola et al. In the European Review of Economic History in 2023 on the problems of top-down approaches. It's a wonderful article if anybody wants one. So just a couple of other points. Kate, looking at yours and also looking at Hossein's, and how important is it, I'm going to ask a few questions, then I'll let you comment. How important are the starting points for different communities? When I look at Kate's histogram there, we see some things that are very important. Others, such as connections to culture or mobility, are not mentioned very much. But of course, for people who are affected by mobility issues or are feeling they're culturally alienated, they might be the top of the list. So that's an issue, is where the starting point is in terms of thinking about these matters. And that brings me to a related question, I suppose, about when we're looking across groups, is how important are the differences between groups and how much are the differences within groups? Almost invariably, when we see social research, we see that differences within groups are far greater than differences between groups in many ethical issues, etc. And so I wonder to what extent, when we see sort of this is what Southeast Asian people suggest, or weird people suggest, etc., maybe the differences are much greater within the groups than between the groups. So I want to think about that. And just as an example of that, the World Happiness Report in 2022 had this wonderful analysis of the importance of Asian concepts of balance and harmony, and showed that those concepts are much more met in weird cultures, Western cultures, rich Western cultures, than they are in Asian cultures, despite that supposedly being an Asian concept of balance and harmony. So the difference, again, between and within groups, I think, is very important. So those are some thoughts for you to comment on, Kate, and I'll just go on to Hossein, and then I'll leave you to think about these while I talk to Hossein. I loved your emphasis on the CBIs of participation and empowerment. And again, that was very similar to the emphasis that Kate put on. So I thought that was lovely to see. And again, I guess the diagram you put up about the CBIs at the global scale suggested to me that they differed a lot depending on their starting points. Again, what the emphasis placed in Africa versus Europe versus North America, etc., reflected the starting points, which probably reflects the importance of participation, that people are coming to these things from their own angle. Two questions I had. One is, I noted in your work, Hossein, that you've got a lot of emphasis on children, and that contrasted with the word frequency that you had from your studies, where middle-aged was much higher ranked than aged, which was much higher ranked than children and young adults. So it seemed like in the broader literature, children and young adults are largely ignored in these approaches, whereas in your approach, children are top, which I would agree with. But with the thinking about why are children in approaches. The other thought I had on your one, you had a lovely phrase at the start that communities are architects of their own well-being. I wondered whether that should be phrased as communities should be architects of their own well-being. So to what extent do you think communities are the architects of their own well-being? Or is that a normative concept that maybe they're not, but they should be? So those are my thoughts on the two presentations. Kate, do you want to just come back with a few comments about my reflections on yours, then Hossein, and then we'll open it up. There's some questions coming through the chat as well.
Yeah, that sounds great. Thank you, Arthur. And your first point about kind of comparing, I guess, what's happening here in Australia to the New Zealand context is really interesting. And Arthur and I had a few chats in Luxembourg at the ISQOLS conference about this point exactly. It's a really interesting one, and I think the lack of consultation in the New Zealand approach, I think, is really stark, as well as the fact that Jacinda Ardern really made it her image. The whole wellbeing budget was framed around her image, and so that's a real problem when a leader does that. And then there's a change in government. Of course, the opposition is going to, or the incoming government is going to want absolutely nothing to do with anything that has the face of another leader on it. So I think there's a lot to unpack there. I think the fact that the Australian framework has dropped off the radar is for different reasons. I mean, we haven't had a change in government since that was released. I think it comes down to as I mentioned, the kind of lack of consultation, but also the fact that I don't know, there's a huge range of reasons. Cost of living has become a real issue in Australia, like it has elsewhere, and kind of that's been the government's focus. And while something like a wellbeing framework can help quality of life and kind of help identify areas to improve quality of life, it was seen as maybe a bit risky to talk about, as well as a number of other things like the challenges of embedding a framework in policies. On your other point, so how important are the starting points, and I guess looking at those areas that were less commonly raised in wellbeing frameworks, and that frequency does certainly not indicate kind of weight of importance for groups. So there are obviously groups that view kind of connection to culture as hugely important, and so I guess so don't think that histogram indicates that those less commonly raised areas are less important for certain groups. They're very, very, very important for some groups. I think what's also really important to note about that graph as well, that we don't really know whether areas that are kind of less commonly raised in amongst certain groups are less important or just less salient. So are people less likely to report them than ask the question? So for example, if you have all your economic and material needs met, you might be less likely to say material needs are really important for me because you just take them for granted. So there's quite a lot to unpack there in terms of kind of the methodology and how people respond to that kind of question. And then I guess just on that last point, definitely, I mean, there's obviously differences within groups as well as between groups. And the irony is not lost on me in terms of the way I guess we did the methodology for that study in terms of demonstrating the divergence between groups, but then we kind of clustered groups to do some statistical analysis. So I think, so that irony is not lost on me, but I think we felt it was just really important to try and convey those at a very, very, very macro level, those divergences are there. I think it's probably quite likely in your example about the World Happiness Report that areas that are very important to groups, there's probably more inequalities in that area, or at least perceived inequalities as well, because it's so front of mind and so salient to people. So that there are just a few points. I'll hand over to Hossein.
Thanks very much, Kate. Hossein.
Yeah, thank you so much. The first I just want to mention is it different from your question, and thank you for your comment. I never know about Katie's presentation. I believe she don't know about my presentation, but we both focused on the communities and engagement and CBI. That's why it's show. I never know what her research, and she never know what I'm going to present just 20 minutes ago. That's why we both focused on the communities. That's why I believe it's globally is a trend subject, and she find that and I find that, but a different subject, community engagement and CBI, like community-based intervention. This is I really surprised when I saw her research. She worked on the community engagement and quality of life as a trend subject in quality of life, and I work on the CBI as a trend subject for the quality of life. But I really surprised. I want to mention that it should be a trend subject. That's why we are focusing both on the communities in different scale. For the research, we are work on the quality of life and CBI. And thank you for the comment you already mentioned. I believe you mentioned why children's and is more important like a group in the studies. Most, as I mentioned in the research, more than 50% of the research, the publication comes from United States. And which I learned from almost 2 years in Purdue University and working with NIH, I mean National Institute for Health. I believe like children and the children group are they are early prevention and long-term impact. That's why they are want focus more on the children. And the second, I believe, by my knowledge and based on the research done from NIH, from the other researcher, even in Purdue and different universities in the United States, the children group are the developmental sensitivity. It means like the intervention can direct effect for the children brain. Who's going to lead the communities are the children. We are like a kind of researcher. We just want to create some intervention. The children should like learn about their own quality of life, about their communities. That's why I believe that this is a kind of developmental like strategy and intervention can affect directly for the children. And the last reason I believe this is the kind of public health priorities in the United States. I believe they are focusing on there is like more than 15 group in NIH, just in NIH, in National Institute for Aging, National Institute for Environmental Health, National Institute for Children and Minority Health. But I believe it's kind of like a public health priorities for the NIH, especially for NIH and NSF, to focus on the children and how the like kind of intervention can focus on this research. And recently in 2024, I mentioned this is a scale. There is a lot of research and publication come from CBI and the quality of life. Most of this research most of them focus on the children. That's because of these three priorities: public health priorities, like is a developmental like strategies, and then this is a kind of early long-term impact for the children because they are going to be young and then they are be aging. They should leave their communities. That's why I believe this is why
I agree. I agree entirely with you,
communities.
Hossein. Can we move on just very quickly before I take one of the questions from the chat?
Yeah.
Do you think communities are the architects of their own well-being, or that they should be? I mean, obviously they should be, but are they?
Yeah, I'm sure for they should be focused on the well-being because this is what the communities should first create the kind of initiative. That's why the CBI focus on the communities. They should focus on their well-being, their quality of life to go and move forward for the other initiative. They should be happy. They should be like free in mind. They should be like they should have a good enough money. They should like enough like physical well-being or I don't know psychological well-being to go
We agree
move
they should
forward
be.
for
My
the
question was, are they?
yeah.
The question is, are they the architects of their own well-being? We all agreed they should be.
Yeah, it should be.
But are they?
Sorry?
Are they the architects of their own well-being?
Yeah, others.
That's the question, I suppose. Anyway, I'll leave that open. I wanted to come to a question from the chat because I think it's a particularly important one and one that's always vexed me. Ron Hayes asks, he says, the title of the well-being included conceptualizations of well-being and quality of life. Can the speakers comment on perceptions about differences and or overlap between what is meant by well-being versus quality of life? I think this is a really interesting question. Kate, do you want to think about this? What's the difference? Is there a difference between well-being and quality of life?
Yeah, I mean, how much time do we have? I mean, in terms of, I think well-being is just used in so many different ways and so many different contexts. I mean, you can talk, well, for some, certain sectors of the community and also for some practitioners, well-being means mental health. Well-being could mean wellness and the mindfulness movement. I mean, well-being is used for so many things. I would say quality of life is tends to be perhaps more an academic term that's used. But one interesting thing I will note that relates to this point. So in the systematic review we did, we looked at how the question was framed. And so we had studies that went and asked, what does well-being mean to you? We had studies that asked, what does a good life mean to you? We had questions that asked, what does quality of life mean to you? And we haven't been able to publish anything about this yet, but we have looked at at how whether the way the question is framed influences responses. And we've found that there's very little influence of question framing on what kind of wellbeing areas are elicited. So it seems that generally for communities, it doesn't really matter whether you say quality of life or wellbeing, people generally come to the same answers.
Well, that's fascinating. I look forward to seeing that research. Hossein, have you got any thoughts on this?
Yeah, sure. Like from the broader, as a kind of like researcher working on well-being, quality of life, happen if they are not focusing especially on well-being, quality of life. Anyone other researcher from different subjects, they think maybe happiness, well-being, and quality of life are same, but they are not. Which, as Katie mentioned, the well-being can be like a very specific indicators come from different communities or different their individual well-being and how they can affect for their daily life. But when you go for the quality of life, is a broader, is kind of umbrella. You can find happiness, well-being, and different kind of subject as a broader subject. The quality of life we use mostly in academia and researchers as a quality of life.
Okay, thanks very much for that. I'm going to finish with one last question from the chat. It comes back to the question I asked Hossein, but it relates to both presentations. Tim Whitaker asks, if communities are not the architects of their well-being, how can they be?
Yeah, this is what I'm focused on this presentation. The communities should work with like a researcher, like communities should work together to create kind of intervention, or maybe work on the CBPR, community-based participative research. They should learn more, because if anyone, they are living in different communities, they don't know specifically what they are. They know already their need and challenges and how they can improve their quality of life or well-being. But they need kind of researcher from academia side. They should work together as a collaboration, which was one of the principle of the CBI. They should work together to create their own well-being. It can come from like an intervention or maybe community-based participatory research as an initiative for their communities to create their own well-being, improve their quality of life. These initiatives, they should work on it.
Okay, thanks. Kate, your thoughts?
Yeah, thanks, Arthur, and thanks, Tim, for the question. Tim's one of the co-founders of the Bega Valley Data Collective, which I mentioned, so it's great to have you, Tim. Yeah, it's about empowering people to be included in processes where they are able to make their own decisions. So that comes to that, community engagement process, which I talked a lot about in terms of better understanding what people feel need to be addressed in the community, like what's the future that people want for their community, understanding that, and then actually taking action to address those issues. So incorporating community engagement in the policy cycle, and that's local government, that's state government, that's federal government. I think, that community engagement process gets lost because it's considered too hard and too difficult and too time consuming. But people need to be consulted throughout the whole process. And I think doing that genuinely and effectively and reaching a wide kind of spread of people is the only way that that's going to be achieved.
Thanks, Kate. Sorry, I'd reflect that what we mean by community is another whole webinar, really, is what scale of community are we talking about? Is it geographic or is it cultural or all sorts of other things as well, which makes it more complicated. We have an observation on difference between well-being and quality of life in the chat. What I suggest we do, Jill, I think you mentioned that there's going to be some ability for people to chat about some of these concepts after the webinar. So I'm going to throw it back to you, Jill, now to finish up and to tell people how they can take on some of these discussions, including this very interesting one about the difference between well-being and quality of life. Thank you, and thank you, Hossein. Thank you, Kate.
Thanks, Arthur.
Yeah, thank you so much to Kate and Hossein for the insightful presentations. Thank you, Arthur, for facilitating the question and answers and for your own interesting comments as well. I wish we had more time. We unfortunately only have an hour slated for these webinars, but the good news is we have an extended Q&A option for anyone who's participating. If you would like to ask some questions or continue to the conversation, I know I have many questions in my mind for both of you as well. There will be a link that I'll be sending out soon with the link to the ISQOLS Slack workspace extended Q&A, and we'll invite Hossein and Kate and even Arthur to engage in that space as well. So feel free to ask your questions there. Thank you again to everyone for your participation. I want to just remind everyone that we have 3 events coming up soon in the next year that will give you an opportunity to participate more of and discuss these and other conversations related to quality of life, happiness, and well-being. Our regional conference in Buenos Aires, our virtual conference happening in January, and then our annual conference next August. So please do make sure that you plan to participate in one or all of them. We would love that. And thank you again to our presenters, to our discussants, to our participants.
Thanks so much, Jill, and thanks so much, Arthur and Hossein, for this conversation.
Thank you so much.
Great.
Thank you, Arthur. Thank you, Katie. I really appreciate for ISQOLS to hosting this kind of webinar to share the knowledge from this different perspective, different countries, different places, and really appreciate for Jill to facilitate this webinar. Thank you.
Thanks all.
Thank you. Bye bye.
My pleasure. Goodbye, everyone. Thank you.